Thank you, Dr. Amar, for the introduction. Good morning, everybody. It's an honor to be here today and speak with this distinguished panel. So today I'll talk to you about bariatric surgery in the Middle East, and sleeve is the king. So I have no disclosures, no financial or conflict of interest here. So if we ask ourselves why sleeve gastrectomy, for surgeons as well as for patients, this is not specific to the MENA region, but as we all know, general surgeons usually are very, they learn through their training how to, operate on the stomach. So in terms of feasibility and learning of the technique, that's an easy procedure to learn. The procedure itself is reversible, the recovery is short and has low risks and complications. From the patient perspective, patients see that the procedure have a reasonable expected weight loss, have tolerable side effects, and then resolution of comorbidities is also good. And then the modification of diet that they have to go through might be not so difficult to manage. And therefore, sleeve really dominates not only in MENA region, but also in the Gulf, but also in the world. So if we look at the Middle East and the MENA region, it's important to understand that there's about 20 countries in this region, and then so there is some heterogeneity in the countries themselves. The population is almost close to 500 million, and Egypt by itself represents about 100 million. And if you ask why this information is important, because we will be talking in a little bit about the data that we have about the Middle East. So it's important to understand there are the differences within the region itself. So some of the countries of high income, others have different health care system, advancement of the healthcare and maturation of the bariatric practice is actually, there's variation among these countries. It's also important to note that education and surgical training is also different among these countries. And also the population have some sort of diverse social, cultural, and disease predominance. So with that in mind, we're going to take a look at the variation between the MENA region and worldwide. So if you look at the IFSO registry in 2019, which is a great step here, there's like over 800 million operation that was done from 61 countries in the world and over 1,000 hospitals. And if you are to look at the data from the MENA region, there's about 11 out of the 20 countries who submitted their data to it. And again, it's different. Some of them have a national registry, there are singular entries or from multicentric. And as I noted earlier, that these countries that were included in the that were included in the IFSO registry also have differences in terms of their economic status. Now, if we look at the patient characteristics, so how is our patient different compared to worldwide? So we're going to go and look at, for example, the age. So from the data, you can see that patients who present for primary bariatric surgery are actually younger in the in the MENA region compared to other regions, and you can see here there at the top. The second, it's not. And it's also important to understand I don't think the clicker is working, I'm sorry. And also it's important to understand that 8 out of the 10 countries that have the lowest age were actually within the MENA region. Can you advance the slides, please? All right, there we go. So, and if you look at combination between gender and age as well, in general, bariatric surgery is more, women undergo more bariatric surgery in all the world. But if you look at the male proportion of men seeking bariatric surgery, they're higher in the middle, in the MENA region compared to the world. And you can see when it comes to the age, the differences is that it can go up to 10 or 13 years having younger patient in the MENA region. Slides are not advancing, sorry. All right, if we look at the BMI, from the BMI point of view, the MENA region is second to North America. And then if we look at Your slides are not advancing. All right, there we go. If we look at the comorbidities, you would see that there's lower portion of patients who would have diabetes, hypertension. Does it work? Oh, okay, so maybe that's better. Okay, thank you. So patient who, if we still wonder why would patient have sleeve and the highest surgery sleeve, you look at the comorbidities, for example, so less than 20% would have diabetes medications, hypertension medications, dyslipidemia. And then if you look at, for example, GERD, which where always the discussion is about a selection of surgery, what kind of surgery, less than 10% of patients have GERDs in the registry. Depression is less than 5%, but I think the reason there is multifactorial. I don't believe this number, but again, it goes to how we document and scan these patients. Now, if you look at the risk scores for bariatric surgery and mortality, the MENA region have the lowest rate, so the patients are of a lower risk. In mostly Qatar, Kuwait, and United Arab Emirates have the lowest score. Now, moving on to primary surgery. So as I said earlier, sleeve is the #1 surgery worldwide, but also you can see here from the arrow that it is the most common procedure in the MENA region, followed by the single estemosis or mini bypass, and then Roux-en-Y gastric bypass. And it's very important to look at the outcome and the long-term outcome. Unfortunately, in the registry, the documentation for the MENA region per se is not present. However, they did show in the missing data in the registry the postoperative complications. So you can see that it has been captured, but unfortunately, you don't have actually the numbers. So these are some of the countries, as I said, in the registry, and these are the postoperative complications. Now, if you look at, there's one study that was published earlier, I think last year, and it looked at the outcome and complications after bariatric surgery within the pan-Arab metabolic bariatric surgery in the Middle East. And it was basically a survey. And then if you look at the response rate was about 63%, and sleeve gastrectomy was performed the most. And then in terms of the complications such as leak, PEs and VTEs, and reoperation rate and mortality, they're all close to what's in other regions as well. Now, I want to show you this study, which is actually interesting because it looks at the, if we wanted to look at the patient-reported outcome, unfortunately, there's not a lot out there about the MENA, but this study actually captures some of the specific consideration, the cultural consideration that could maybe help improve the care and the services for bariatric patients. And they have identified 6 domains, and then from these domains, such as, for example, the slides are so far, sorry, I can't really read very well, but from the 6 domains, there's patient quality of life, mental health, access to care, family influence, and so on. So it's important to take all these steps. For example, religious reasons, Muslims patient, for example, do fast the month of Ramadan. So for example, on that month, you would have a drop in the patient who will undergo bariatric surgery. And similarly, in terms of restrictions for diet and so forth, if you're having the procedure close to that month. And then in terms of access for care, although they say the access of care is not optimized. However, you would see actually a variety of range in the Middle East from somebody who can actually come in and have their surgery the next day compared to other people who would wait for long. And this goes back to the variation that exists between all the countries. And as I'm coming to the end of the talk, and I know that we said the sleeve is the king, but I want to argue and say it's actually the queen, because most of the patients are actually women, and then most of them are undergoing bariatric surgery. But also, Arabic is actually a gender, like we have feminine and masculine in our language. So if you are talking to people in the Middle East, they will say amaliya, which is operation, and it's all feminine. Whether it's a surgery, it's again a feminine, jiraha. And if you say stomach, it's ma'da, and it's same feminine as well. So, and obesity is feminine as well. So across the board, it's she's a queen. And then just to conclude my talk, that sleeve is #1 bariatric surgery in the Middle East, and it's very important to understand the diversity in the region of the MENA as well when we compare it and interpret the data. And it's very important that we will continue to collaborate to push the care of the bariatric surgery and patient forward. Thank you.